two, one.
Hello, my lovely viewer. Welcome back to another episode of Room 1221 Live. I am so excited to have you here with me today. Today we're talking about something that matters to all of you, something that you'll be very, very interested in, so keep your eyes peeled and keep your ears open. I'm joined by two professionals once again, because you know me already, I'm always hanging out with professionals. I only deal with experts in the field, right? So I have here with me Nurse Barbara and Dr. Mevo. Welcome to Room 1221 Live.
Thank you.
Could you please introduce yourselves to us?
Okay, I'm Barbara, nurse with the public health unit at Obujo Polyclinic. Yeah, basically.
Welcome, Nurse Barbara. Dr. Mevo.
Okay, I'm Selom Amevo. I'm a pharmacist with the University of Ghana Medical Center and Ali Pharmacy.
Thank you for joining us once again. So viewer, today we're talking about contraception, family planning, and birth control. What is it? Why does it matter? And why should you plan your family? Dr. Mevo, what is family planning, first of all, and what methods are there?
Okay, so family planning is basically the methods that partners or couples use to determine how many children they want to have and how often they are going to have those children. So it basically deals with methods to space the number of children that they have or they want to have. Mm-hmm. Yeah. And it has its benefits for the family as a unit, and it has benefits to the economy and to the whole world as a whole. I'm sure we'll delve into that.
Yeah. But what about the methods, please?
The methods for family planning.
Yes, please.
So when we talk about the methods for family planning, the first thing that comes to mind is you first think of the decision by the couple, right? So it starts from the education bit of it. So family planning starts with education on what the options are, and it starts with what the couple would want to achieve, right? Mm-hmm. Then we come to the contraception, which is the methods that control or prevent child pregnancy and to that extent the childbirth as a whole, right? So for contraception, we have various methods. We have the barrier methods, and then we have the hormonal methods. And for the barrier methods, the common ones that we know, we have the diaphragms, we have condoms, both male and female condoms. Then the hormonal methods, we have IUDs, we have implants, we have the pills, of which we have the daily and then the emergency contraceptive pills. But for our markets, I think we are more used to the emergency contraceptive pills. So basically, those are the contraceptive methods available. And even though abstinence is the one with 100% success rates, because I mean obviously you're not doing anything for partners, right? That's say you're married and you want to do family planning, you shouldn't stop having sex or anything just because you want to space the number of children that you have or something. So even though abstinence is a part of the methods for partners, we think more of the contraceptive methods, the rhythm methods and all that.
Okay, thank you, Doc. Ms. Barbara, could you please tell us the difference between family planning and, just getting lucky by not getting pregnant, or just coasting and just doing the natural way?
Okay, basically family planning, like my colleague I would say, it is more like planning your family and making choices that would prevent unwanted pregnancies. Okay, so if we should say difference between that and then just playing safe, We say family planning is like a consistent practice. Okay, you've picked a method, you are very faithful to it. You go in, when you have an issue, you correct it, you move on with it. But to play safe, to say, it's either you know how your, let me say, your ovulation, your menstrual cycle is, you want to have sex on a safe day, you want to probably on the other day that you were not able to practice the safe sex, you want to go in for like an emergency contraceptive to prevent pregnancy. So I'll say that's a difference. It's like the playing safe is timely, like within certain period you want to be careful. But if it comes to family planning, you always want to be careful, so you are with a particular thing that you are practicing.
Okay, so you'd say that the family planning intentionally and consistently is, you know, better.
Of course,
than
of course.
Yeah. Okay, thank you, Ms. Barbara. Now, Dr. Mepo, back to you. You mentioned that family planning had economic benefits and benefits for the society and the community as a whole. Could you please elaborate on that?
Okay, so every year, right, the various governments in various countries spend a lot of money on child health and then maternal health. You know how there are a lot of subsidies on maternal and then child health, especially with our country, right? So if there's family planning and contraception to that extent, if there's a reduction in the child birth rates, if there's reduction in number of unwanted pregnancies, then it means that there's going to be a reduction in the burden on the economy in funding maternal and then child health. There's also the bit about maternal and child mortality. I mean, we lose pregnant women to, like, we lose them to death just through pregnancy, even though it's over the years it's reducing, but it's still of economic concern to us. We don't want to be losing our active workforce to pregnancy. We don't want to be losing children through childbirth. So all those things have economic benefits to the country.
Yeah. Okay. Thank you. Now let's talk about the myths and the misconceptions surrounding family planning. Personally, I've heard so many things. I've heard that it's for, let me say, promiscuous women. You know, I've heard that it has adverse effects on your body, some crazy ones, like it will stop your menstrual flow, and it means that your blood will get stuck in your body and things like that. First, let me start with you, Nurse Barbara. What are some of the myths you've heard, and what do you have to say about them to our viewers?
Okay, so being in the system for some time now and being a family planning nurse, I would say usually I come across some weird kind of I should say complaints, let me say it that way, because there was a time a client walked in and all she could say was she came in, actually it's a young lady, like an 18-year-old. She came for the family planning by herself, but later on came in with the mom. Okay, so the whole issue was that she's pregnant, but she told the mom she came in for family planning. So we didn't offer the right method to the mother, or we gave an expired drug or something. So we're like, calm down, let's trash it out and see how best we can think about this and solve it. The mom was like, no. The father is a lawyer, they're going to sue us. This was a really tough time thing. Like, my boss then was really like, I don't know, confused, don't know how to go about the whole thing. So we had to go through a talk. We explained it. Said, okay, she came in, actually, I met her on the first time she came. Okay, so we went through the pregnancy test. That's the usual thing. We want to test and make sure you are safe before you go on the method. And aside that, we asked them, are you already menstruating as you're sitting here? Even if you are, we still take you to a washroom and girls, we want you to remove the undies and we see you are bleeding before we give you the method. So I asked the young lady, okay, when you came, what did we do? She said, we made a test, but then she's pregnant. I was like, okay. When you came, we asked you, did you had sex probably the week you came or before? You said, no. Didn't you? She said, yes. So, okay, fine. Could we ask you to call your guy since you're now pregnant? Definitely you had someone you were seeing, right? So we want to talk to the guy to see if he can remind us the last time you guys had sex. There, she was like, no, he doesn't have phone. And the mom was like, what are we trying to say? We said, okay, if this is the case, what we give to your child isn't expired, doesn't have any fault, but the only thing would be that the pregnancy was already taking place.
Yeah.
When she came, we asked her questions, we give you the privacy to express yourself, but some people still withhold the information. So I think that's what happened. So pregnancy was already happening, but we gave the method, and it doesn't stop it.
Yeah.
Some think with the pregnancy, even if they come for the method, it aborts the pregnancy.
Oh.
You see, so I think at that stage she was thinking like that. She knew she might have been getting pregnant or would be getting pregnant, but she rushed in to save herself. So that day, eventually, the mom realized she was just angry for no reason, and the girl had to apologize. Funny enough, it was an injection, 3 months. So they were like, so what do we do now? Do we take the fetus out? We said, no, if you're ready to take care of it. Family planning doesn't spoil your pregnancy, it doesn't have any effect on the child. You go through your pregnancy stage safely and everything. So that's how they left. But then I don't know the outcome, whether they went to terminate or not.
I was just about to ask you.
No, okay. They will never come back to you. Others too come and they're like, they have chest pain, their tummy aches. Ever since they went home, it's palpitation. They've been going through. So they feel the method you've given is the one giving the problem. Then we tell you, please go and see the doctor. If the doctor says, it's the family planning, and if you're on an implant, we take it out. But if you're on injectable, please do not come back again. So there are so many things. Others also tell you, because I'm not bleeding, I'm having fibroids. My friend told me I'll have fibroids. Family planning actually, it looks like we need to talk more about it.
We do, huh?
Yeah, because people have a lot of things. You can't even imagine it. Somebody says I was 60 kg when I came, now I'm 80. Family planning is making me go big. We say, okay, fine, it's okay, it's hormonal. At a certain stage, it makes you eat. But if you're not told, you just leave yourself, eat anyhow, do your normal things, and you see you're adding weight. But if you are very much aware of it, you know how to regularize your dieting. Either you're doing heavy morning, evening, you're doing something light to check your weight.
Yeah.
Okay, so it all depends. I would say it depends on the methods. Yeah.
Okay. Thank you.
Thank you.
Yes. How about you, Doc?
So I think the commonest one that you'd face is that the daily oral contraceptives or the injectables, the IUDs will cause you to be infertile in the long run. Yeah, that's actually part of the reason why a lot of people prefer to do the emergency contraception and not do the long-term ones, right? Yeah.
Wow.
There's that concern about infertility in the long run, but it's only a myth, right? Most of these contraceptive methods are actually reversible when you get off them. The only thing is that some of them may take a while before you can conceive, but they are, unless it is a permanent method like tubal ligation or vasectomy, all the other ones are reversible. And even for the ones that take a longer period for you to be able to conceive after you get off it, if it is the case and then it's taking too long for you to conceive after you stopped it, I mean, it is also important for you to visit your gynecologist or obstetrician and then we investigate to see maybe it's not even about the pill. There's something else that may have been missed that may be causing you to not be able to conceive.
Yeah.
And I mean, we've already spoken about the menstrual cycle in the previous episodes, and the timing is also important for conception, right? So all those factors come to play. So there's nothing like these contraceptive methods are going to cause you to be infertile now.
Okay, okay. Thank you both. Next, Barbara, back to you.
Okay.
You've told us a very, very interesting story. So now I want to hear more. I'm doing small concern.
Okay.
What are some other experiences? But this one, let me narrow it down to first-time users, especially. So people come in for the first time, they're coming to do consultation, and they come to see you on the family planning method. What are some of the experiences you've had and the interesting things you've seen?
Okay, so sometimes some come in with their partners, okay, and the men really want to know, not about the ladies here, the men really want to know. Okay, my wife or my girlfriend, we are deciding that we want to do family planning. Tell us more about it. You explain and explain, and you just see the gentleman will be like, okay, so the first one that will make you laugh is that it starts working today. So you see that they are here to go and then start whatever they think it should be. So when you say like, okay, probably 12 hours, that'll be from today till tomorrow, probably, are we 11, I think 12, something like that.
Yeah.
That's when you start working, they're like, okay. They'll go and think about it and come back. And I'm like, wow. So sometimes you'd find yourself in a situation whereby you'd even have to give them your own contact. You take theirs. Once they are leaving, you call again to like convince them. Since some of them comes like they've conducted an abortion, they don't want to go back to it again. We don't like hearing those stories. So if you are able to come in, we want to solve the problem. We don't want you to go and make the same mistake before coming in. Some too would ask and ask. You say everything in this life. It's okay. I would prefer postnatal 2. Because it's he or she, or I should say, she's thinking, probably if there'll be bleeding. I don't want to go to the stress of coming in. And some will say, I'll be losing weight. I don't want to lose weight. And some of the family planning also stops your ovulation. That's one major thing. Okay, it thickens your cervical mucus. So the sperm is not able to travel to the egg, or sometimes it stops the egg from moving into the womb for a menstrual cycle to take place. So if you have to explain all this, the person is like, so that means maybe sometimes I wouldn't have my menses. That means blood is accumulating in my womb. And like, I don't know, sometimes we get so, no, I shouldn't say fed up, we get tired of explaining, because you're telling this person that isn't the issue. Says, my friend said so. Then another problem has come.
So now they are believing their friends
other than what the provider is saying. So you see, it's a whole thing. Then sometimes a colleague of mine that is there, who is on one of the method he or she is interested in, will say, oh, this is my own, like the implant especially. Look at mine. For 6 months, I haven't menstruated. But look at me, am I not fine? That's when someone is convinced to say, I want to go on it. Okay. Sometimes you see another client sitting outside who will now go and call you. Okay, have you been on 3 months? Have you been on 1 month? How is it like? Then they'll come in and explain to the one that is in to now go on 1. So it's a whole thing. But then with that, we also feel fulfilled because you're able to help someone make an informed choice. Okay, you just don't let's say she's not so convinced. So you go, when you're convinced, come back. We don't want that one, honestly. So some of the experiences we have are those. Okay.
Thank you so much for your patience for us. There's my breath wasn't for you, like by now.
most
Thank
of the
you.
people that are pregnant, you see.
Thank you.
You're
Now,
welcome.
Dr. Bevo, back to you.
Okay.
How do I know which method is right for me?
Okay. So, when you go to the family planning clinic or when you speak to your healthcare provider, the first thing they are going to do is to give you the options that are available to you, right? Mm-hmm. And in giving you the options that are available to you, we would also have to know your background. Do you have any chronic condition that is going to interact with the medication that you'd be using, right? Yeah. Once we have those two factors in place, and then we give you the options that are available to you based on your current condition, then at the end of the day, the choice is with you to make. It is not the health provider that's going to make the choice for you that, you know what, take the pill or use the IUD, or say you go to the family planning clinic and then they tell you about all these options and tell you that it's only the IUD we have, so that's what you got to get. That's not how it works. At the end of the day, the choice lies with you. If after explaining to you, you think that it's the IUD you want to go on, whether it's copper T, whether it's hormonal IUD, that's your choice to make. Ours is to just provide you with the necessary information, which includes the possible side effects, right? And then you make your choice on which one to go for. But then there's the issue of probably starting on one particular type of contraception, and then it doesn't work well with you, right? And for that one, for the minor side effects like the variation in bleeding, the spots, and those ones would usually resolve after like 2 to 3 cycles of being on the medication. So usually we don't worry about that. But for the ones that may cause like severe adverse effects, I mean, you mentioned something about the myth on the blood becoming thick and all that. I mean, the estrogen containing contraceptives actually have a role to play when it comes to coagulation of the blood, right? So it puts certain patients at risk. That is why if you are someone that has any bleeding disorder, or you are someone that is at risk of having your blood clotting, right, based off some condition, you have diabetes or something, we may not want to go in for certain methods. So at the end of the day, it is patient specific. You can't just know from the scratch without having the necessary information given to you.
Okay, thank you. What if, let's say, in my mind, right, I want the copper T IUD, and I come and say, oh, I want the copper IUD, but for some reason, that one is not the right one for me. Maybe I might react to something or something. What would we do from there?
Okay, so for example, you want the copper T IUD, right? The copper T is non-hormonal. It just releases little amounts of copper that is toxic to sperm, and that also makes the uterine wall not favorable for implantation, right?
Yeah.
But what you need to know about the copper T is that that one has a side effect of a possible increase in bleeding, right? So your menses may be heavier, then you may have painful menses, but they also resolve over time. But say you react to copper, for which reason you cannot use the copper T IUD, then we can consider the hormonal options that are available to you, or even the barrier methods. At the end of the day, like I said, the choice still lies with you. I mean, if you are reacting to it, that's a no-go. But then we give you the other options available, and then you choose. If it's still an IUD you want, there's the hormonal option.
Okay, thank you. Now, Ms. Barbara, back to you. What about the mood swings? Let me explain. If I'm on birth control and I'm experiencing mood swings, what can I do about it? Because I can't go about my day. Today I'm smiling. This minute I'm smiling with this person. The next second I'm shouting. Next second I'm crying. So how do we go about that?
Okay, so the methods, some are hormonal, like my colleague said.
Yeah.
So, hormones, we women especially, unfortunately for us, we are the ones going in for the methods every now and then. The men wouldn't go for vasectomy, never. So, it affects our moods at times. Just like a normal person, your estrogen levels are sometimes high, progesterones are flying from here and there. If you can imagine if that is already a problem for you, and now we are introducing something that is increasing that amount of hormones, you know, you should be, I'm sure every provider would have explained to you, this is something that will increase your hormones sometimes, fluctuate it sometimes. So if you're having mood swings as a woman, I would say control yourself. Because you might not even know. You could see that within a minute, somebody just said something that on a usual day you are not bothered, but that day you are like flying up there.
Yeah.
When you see that, please excuse yourself. Just tell the person you are coming. And take in some small air. If not, I'm telling you, no, you will cause some problem that later you can't resolve.
Yeah.
So I would say because of those hormonal things, that's how come sometimes our mood swing, and then I say uncomfortability in your body comes in. So you should just have control. That's all. There's nothing we can do about it unless probably you stop the method. You go back to factory set, then that's fine.
Okay.
You get it.
Thank you. Now, Dr. Meva, before we wrap up and I ask you both about your final words for our viewers, how or where do I find this help when it comes to family planning? Where do I access this service?
Okay, so family planning services are by the day being increasingly available, right? So you can find these from any family planning clinic, any public health facility in Ghana. Most of our clinics in the country have those units. And even now, even in pharmacies, there's family planning services available, pharmacies, and you can just walk into any facility, ask for family planning services. That particular facility does not offer or does not have someone with expertise to give you the necessary planning that you need, they would definitely refer you to another facility. So it's easily accessible.
Okay, thank you. Now, thank you both for your time and thank you for joining us on Room 1221 Live. Before we close and wrap up for today, what are your final words for our viewers? Let me start with you, Ms. Barbara.
Okay, I'm glad I have this opportunity today. Honestly, family planning is not really all about married couples, I want to say. The youth, for me, I would say, most of you, those that you know you're not ready for family, just plan yourself. The family planning, plan yourself. Come in, walk in at any time. Even the pharmacists are ready to help you. Because some of you feel shy because the nurses, they say we talk. Go to the pharmacy. They would help you. Instead of the emergency pills, just pick at least a short-term or a long-term method, and you have your peace. That's it. If you have any complications, they'll help you solve it, and then you continue with your peaceful life. Thank you.
Okay, thank you to this, Barbara. Dr. Meva.
Okay, so I'd also touch on the bits about the use of emergency contraceptives, right? If you find yourself having to use emergency contraceptive pills like once or twice in a year, it means that you should probably get on a long-term contraceptive option, and all these options are available. The myths and the stigma associated with them are things that we are ready to help you debunk, and the fact that there are side effects does not necessarily mean that you are going to get them. So please, if you are going to have it up to 2 times in a year, please talk to your provider and get on a long-term method. Thank you.
Thank you once again, Dr. Meva and Nurse Barbara. It's been a very insightful conversation, and yes, thanks for offering your knowledge and your professional advice. Now to you, it's a wrap. It's a wrap. But before I go, you heard the nurse, you heard the doctor. You have IUD, you have injectables, you have oral daily pill. Choose a long-term option and let the post pill only be for emergencies. If you have any problems, if you have any questions, or you need any help, pick up your phone, dial 1221, and we'll always be here for you. I'll catch you on the next episode. As always, my name is Ivy, and I've been your host. Peace.
Room 1221. Room 1221.